Hey everyone, welcome to my YouTube channel. I'm actually stuck because I've got my colleague who's just staring at me. I don't know why she's staring at me. And this is not normally how I start my channel, but look, I want to welcome all of you today because this is a very, very important topic that we're discussing today. For those of you who don't know me, my name is Faheem. I'm a pharmacist prescriber, contractor, founder of Medlearn. And in today's video, we are discussing Health Education England funding for those pharmacists who want to become prescribers and talking about developing your scope of practice. Now, as you probably know, with any channel, I need you folks to like, subscribe, and share, and let's together build a better world because it's something that we can do and we can achieve it together. Now that my colleague has gone, I can start to focus on the video itself. So I'm just going to have a look at the main points that I want to go through today. The first thing I want to explain to you is that the Health Education England is essentially a body that is responsible or plays a major role in helping uplift or working on the education side for pharmacy, for example. They also work with nursing, they also work with all those professions that essentially play a role in health. So we've got nurses, we've got pharmacists, we've got paramedics and so on. But our focus is on HEE and what they're doing specifically for pharmacy. And essentially what happened was in around last year, autumn time 2022, they had decided to announce that pharmacists, around 3,000 pharmacists were going to have access to funded places for their prescribing course. So in a previous blog, I've spoken about how to become a prescriber, you have to attend university and you have to pay around anywhere between £1,000 to upwards of £2,000. I've heard £3,000 for some universities to gain your prescribing qualification. And what the universities or Health Education England has decided is that they were going to take it upon themselves and going to fund for the qualification itself. So autumn 2022, we get an announcement that 3,000 pharmacist funded places will be available for you to gain your prescribing qualification. And I have a lot of students get in touch and they ask questions like, tell us a bit about this funding. How do we get access to this funding? When is funding going to end? Do I have to apply separately? What makes me eligible for this funding? What are the steps? And we are going to cover it all in depth. Another important thing that I do want to talk about, and that is scope of practice. Because in order for you to get this funding, it's very important that your documentation, your paperwork, your application form, your scope of practice, and your personal statement all are in sync with the vision of the NHS, the future of pharmacy, and also essentially what you're looking for, or rather what they're looking for, HEE and university. So we're going to be discussing all of this. So I want to sit tight and again, subscribe, like and share, tell your friends about this. Let's together uplift our profession. Let's build a better world. So 3,000 places. The announcement comes in autumn 2022. It was ending in March 2023. So March 2023 was when the funding places was going to end because there were only 3,000 places available for pharmacists. Now, that is not to state that there isn't going to be funding available later on. There probably is going to be funding available later on, but right now it was supposed to stop March 2023. And you're probably sat there and you're thinking, well, should I even listen to this discussion? Should I even pay attention? Because we're in February now, there's only 4 to 6 weeks available and that's it. However, my advice is if you are still considering to get funding, get in touch with the universities directly. Send them an email right now and say, look, I'm interested in becoming a prescriber. Are you still offering funded places? Because they may have still funding available and we'll discuss about how this funding works. So that's a bit of backdrop. Who can actually apply for the funding? Number one, if you're a community pharmacist, if you're a locum pharmacist, you are allowed to or have access to this funding. If you work in a GP practice, you also have access to the funding. If you work in hospital, part of an NHS trust, part of some sort of mental health delivery service, you also have access to this. So these are the three categories that essentially give you access. So if you're a pharmacist, essentially you have access to this funding. That's the first thing. Farooq, follow me. Let's have a look at the next points that we've got to be discussing. So we've discussed about this. Let's talk about what makes you legible. What's the requirements? Number one, you have access to a DPP. So if you're struggling to find out what is a DPP, what is a DPS, how do I get access to a DPP, we can help you. We can help you source one. And I've done a separate video on this, which is going to be in the link. And it might actually pop up in a moment on the side on the YouTube channel. Have a look at that and do watch that video because it's important. You will get access to no funding if you don't have someone willing to supervise you. Number two, you need to have a suitable placement. So whatever you decide to do your practice, whatever you decide to do your learning, you need to make sure that they are supporting you. They are there to ensure that you get the best out of your learning. That's important for you. Number three, what's important is the entry requirements for becoming a pharmacist prescriber. And again, one of the entry requirements is having access to a DMP or DPP. You need to be qualified with a certain amount of experience. And the law has changed where you don't have to be qualified for 2 years or 3 years at some point it was to gain your prescribing qualification. That's been scrapped. However, the universities have not updated their entry requirements yet. Keep that in mind. So because the universities haven't updated their entry requirements, you might get in touch with them and they might say, actually, we need until April, May, June, later in the summer to essentially let that all come into place because the GPHC has scrapped the idea of you being needed to be qualified for over 3 years to gain your qualification. Keep that in mind. So a summary, 3,000 places become available in autumn, ending in March 2023. Get in touch with the universities to make sure you have access to it. Number two, what makes you legible? You're a pharmacist, irrespective of where you work. You've got somebody willing to supervise you. You've been qualified with the experience, and we'll discuss all of this in your personal statement, what I mean by this. Now, how do you apply for funding? To get access to the funding, all you have to do is you have to apply to the university. You have to inform the university that you'd like to have HEE funded places. They will allocate the funding. You don't have to separately apply anywhere. You don't have to get in touch with HEE directly. All you're simply going to do is apply to the university and inform them that you would like HEE funding. That's what you have to do. A lot of pharmacists get in touch and ask me, Faheem, how do I apply? Do I have to do something separate? Nothing like this. The university will give you the funding. And remember, and I probably haven't mentioned this before, not every single university got access to funding. Let me repeat that again. Not every single university got access to funding. Certain universities did. So before you go ahead and do your application form, check with the university, did you get access to HEE funded places? Keep that in mind. This concept about being less than qualified for 2 years, as I mentioned to you, in 2022, the GPHC announced that you don't have to be qualified for two years plus to be able to apply for your prescribing course. But the universities haven't updated their entry requirements yet, and they haven't updated or had their courses accredited. Because think about it. Initially what it was, you have to be qualified for 2 years. And that was demonstrating that you have the experience. But now, pharmacists can be qualified for less than 2 years. How do you demonstrate that you have the experience? And this is where the universities have to slightly tweak the entry requirements to be able to make sure that this pharmacist, or you who's watching now, you've been qualified for less than 2 years, but you have the required skills and you meet the requirements, and we'll discuss them later. So now let's talk about your scope of practice and personal statement. When you gain your prescribing qualification, it is going to be in a certain area. Please do not fall for the trap, and that is that you have to be qualified, or rather, before we actually continue, let me just pass this phone on, it's making a bit of noise, and I'll give it to my lovely colleague Denise. Denise, if you can just have a look at that. Anyway, let's get back to where we were. What I was talking to you about was scope of practice. When you gain your IP qualification, you will have an area that you will practice in. The reason is because you cannot expect to learn every single part of medicine in 6 months. It's not enough time. Instead, what you're going to do, you're going to pick an area. And that area might be, for example, UTIs in women who have uncomplicated UTIs with no comorbidities between 18 and 65. Very specific. You might choose to do hypertension and say, I'll treat hypertension stages 1, 2 and 3 with no comorbidities between the range of 140 all the way up to 165. So you have to define your scope. It is not enough to say that I want to learn to prescribe antibiotics. That is going to get you in trouble. You don't want to be saying that. It is not good enough for you to say, I want to learn to prescribe in ENT. You have to be a bit specific. If you want to do ENT, you might say, I want to learn to diagnose, manage and treat patients who present with ear-related conditions, aged between 18 and 65, who are systemically well in, let's say, otitis media. Maybe you want to do a cough. I want to learn to prescribe, manage and treat coughs in adults with no other symptoms who are systemically well and XYZ. So you have to define your scope, because what you are going to learn this year is how you develop your scope of practice. This course is not designed to teach you everything. It is supposed to be in an area that you already have the skills in. For example, it needs to be in an area where you are taking a history, you are examining patients, you are already documenting, you're a reflective practitioner. We'll discuss this in a later video in depth, and you're doing all that process from start to finish. That's what needs to happen. Very important for that to happen. So how you pick your area will depend on your experience. And I would say as a pharmacist, Denise, what do you think? Minor illnesses is a good one for pharmacists.
Yes.
So, treatment of cough and colds, that's something that you can do. Dermatology, acne, eczema, something you can choose. Maybe you want to go with possibly cough. I would stay away from things like chest pain, shortness of breath, because there could be many causes. And in a community pharmacy, how would you rule out something like a PE? You won't be able to do the D-dimer test. You see? If somebody has hypertension in a community pharmacy, how will you make sure that there's no end organ damage? What about the biochemistry taking bloods? What about making sure that they don't have any secondary conditions? So that's why I stick to something straightforward. And you have to make sure that you talk about how you take a history, how you examine, how you document, how you go through that clinical decision-making process. For example, I have a patient who presents with a cough. How do I make sure that this cough is either a bronchitis or a pneumonia or a PE, maybe heart-related or maybe GORD or maybe a foreign body? You have to briefly explain that I take a history. I rule out a pneumonia because the patients will normally have a fever. When I do an examination and auscultate, I'll hear certain findings on the chest, wails, rattles, and so on. So that's how you briefly mention in your scope of practice. So the person who's reading your scope of practice, or your personal statement rather, your personal statement really understands that this person is trained and has a proper understanding of the condition that they're managing. So keep that in mind. You'll also have to mention that I take a thorough history and I document. Any patient that has to be referred, I write a letter and refer to the GP, and I always reflect on my practice. And also what I do is I always follow up with patients. So to summarize, your scope of practice should be in an area. Number one, ask yourself, do I see patients on a regular basis in this area? How do I diagnose this area? Do I do it? Do I take a history? Do I examine? Do I know enough about the condition? Do I know enough about the examination process? Do I practice evidence-based medicine? What prescribing do I do? And it can be over the counter. For example, chloramphenicol for the treatment of conjunctivitis. For example, if you're prescribing something like, let's say you're recommending Humavate over the counter or hydrocortisone over the counter for eczema, so you are playing a role. And you take a history all the time. Ask yourself, how do you know that this person has conjunctivitis versus a sty? How do you know this person has conjunctivitis versus hay fever? Because you gather that information. It may be in the form of, and I'm going blank, Denise, what's that called? The basic history taking rule that we use in pharmacy, what's it called? It's not old cart, it's WHAM. WHAM, there you go, WHAM. So you're using WHAM. What does it stand for? I can't remember what.
Who, what, how, when, action, medication.
Yeah, something like this. So, you're doing it all the time. So you are, whether it's WHAM, whether using the Cambridge and Calgary model, you are taking a history. But you need to start to take that history in a more formalized way, in a proper pattern, with a presenting complaint, history of presenting complaint, family history, social history, drug history, review of systems, allergies. We'll discuss all this in a later video in depth. Don't worry about it. But essentially, these are the questions you're going to ask yourself. If you're choosing your scope of practice, be honest with yourself. How many patients do I see? How do I take that history? How do I examine? How do I make sure that they have this condition and rule out all the other conditions? then that will be enough to convince you this is my scope of practice. And for example, diabetes. In a community pharmacy, in diabetes, you're dispensing the medication, you're handing out the medication, but you're not really involved in the entire history-taking process, the examination process, the differential diagnosis. You're not doing that, the blood work, the monitoring. So in a community pharmacy, it does not make sense for you to choose diabetes. So that's a bit about that there. Scope of practice, what it is the area that you will learn. And it's true, after your 6 months, it is correct that you cannot go ahead and start to prescribe in anything. Think about it, how would you be safe? Imagine I've been trained to drive a car. How am I safe to go ahead and drive an aeroplane? Oh, well, you shouldn't say drive an aeroplane, fly an aeroplane. What makes me safe to fly an aeroplane? I've not been trained. How can I learn to drive a car and then go ahead and start to, ride a motorcycle? You see, you have to go through the hoops, you have to do the test, same thing here. You've been trained in your scope of practice. Your scope of practice. That doesn't mean that after you've got your training, I can go ahead and start to prescribe in diabetes, cholesterol, asthma, COPD, start to carry out surgery and start to, open up the thorax and start to carry out all these things. You're not trained to do that. You can be trained, but it's a process you have to follow. You have to go through the process. You have to learn your theory. You have to learn your practical skills. You have to be observed. You have to be signed off. So your scope of practice is where you start. After you qualify, you can develop your scope of practice, but you have to go through the same stages. You have to know your theory, number one. You have to then be observed. You have to then be supervised. You then have to see plenty of cases, and then you need to be signed off. So please make sure that you always check the standards of the GPHC and you always reflect on your practice and don't do anything that you're not competent to do. And we'll discuss competency in a later video. So, perfect, that's been done right. Now what am I saying? What is it? I've explained. Why is it important? It's very, very important because it gives you a framework to work in. It would be way too much for you to say, right, I'm going to start to prescribe in every single condition. You'll never pass your course, it'll be too much. Selecting your scope, I've discussed that about selecting your scope. Expanding out of your scope of practice, how you expand out of your scope of practice is you have to go through this entire process again. It's like learning to fly an aeroplane. You have to know the theory, you have to pass tests, you have to then do some simulation, you then have to be observed, you then get supervised, and then you pass. So you're going to go through all of that again, and we will discuss this later on in a bit more depth. Okay, with that being said, some tips. I would say get in touch, send us an email, contact us at Medlearn. I'm happy to advise where we can. My team can get in touch. So I'm happy to go through this with you in depth. But be honest with yourself, look at yourself in the mirror and say, right, am I really able to diagnose hypertension? It looks a bit weird actually talking to your hand, so don't talk to your hand, actually do it in front of a mirror. Am I really able to diagnose diabetes? Just be honest with yourself. Right, lastly, let's talk about personal statement. The personal statement is, I would say, one of the most important aspects for you to gain your HEE funding, because it demonstrates everything that is important for you to gain the funding, and that is the requirements. Because number one, your personal statement will briefly talk about how you are going to be prescribing, which area you're going to be prescribing. It's going to talk about linking policy into your prescribing. For example, why are you prescribing? You have to mention, I want to in-sync myself with the vision of the NHS. I want to better myself as a professional. I'm aware of what the future of the pharmacy is, or the pharmacy profession. I know the GPHC standards and the reforms that are now going to be in place for pharmacists. So always link policy. It shows that you know exactly what you're talking about. So that's important. And remember, a personal statement is all about advertising yourself. It's where you're telling the reader that I'm competent. I'm ready for the course. I can take a history. I can examine. I can document properly. I reflect on my practice. I understand the importance of the IP course. I know my limitations. I work within my scope. So that's what the personal statement is. And it's around anywhere between 300 to up to 500 words. Every university is different. But I would say when you write your personal statement, start off by talking about the difficulties that we have in the UK at the moment. There's 2.8 doctors to 1,000 people. NHS waiting times are not being hit in terms of the target itself. GPs are struggling. Patients are not getting access to medication or consultations. As a pharmacist, you can uplift the profession, in-sync yourself with the vision of the NHS, support GPs. This is why the IP qualification is the right time to do it now. Then go on to talk about yourself. Where did you qualify from? I qualified from X university. I've been doing this for 5 years. For example, COVID vaccinations. I've been involved in travel vaccinations. I've been involved in minor ailment services. I'm involved in, let's say, maybe some HIV testing services. Maybe you've taken bloods. Maybe you work in a GP practice. I do regular MURs. Whatever you do, talk about it. Very important to talk about that. Then go on to talk about the condition itself. Define your condition. I would like to gain my prescribing qualification in the diagnosis and management of UTIs between the ages of 18 and 65 with no comorbidities in females who are not pregnant. Remember, this course is not teaching you your scope of practice. This course is teaching you how to safely prescribe within your scope. You should already have the clinical skills. You should already have the experience. So please don't pick a condition where you're like, this is what I intend to learn. This course is not designed for that. Once you've mentioned that, talk about what you're doing at the moment in that condition. When I have a patient who presents with a UTI, I take a history. I focus on symptoms like tenderness of the costovertebral area. I talk about, or I ensure that the patient is systemically well, so they don't have a high-grade fever, they don't have nausea, vomiting. I rule out the differential diagnosis such as pelvic inflammatory disease, kidney stones. Denise, any other ones? Pelvic inflammatory disease, kidney stones,
Upper UTIs.
pyelonephritis, upper UTIs, STIs, STDs. So you're showing them that you understand this. If the patient you felt does have these symptoms, I will then advise the patient to go see the GP. I will document properly. I will then send a referral letter. I will also do a follow-up with your patients. Then that paragraph should be in there. Then talk about why you want to join the university. Briefly mention that you want to join the university because of its academic, because academically it's quite strong, they have the resources, they have the infrastructure, and then mention about how you're ready to study at level 7. You're already a master's level student. You've undertaken training with various CPD, for example, organizations like CPP. I can't believe I've actually just ummed and ahed. I normally never and ah in my video, but I was just about to get stuck. So, that is a new one for me. But let's get back to what we were discussing, and that is that talk about CPD with CPPE, self-learning. Maybe you've done some training with Medlearn or whatever you've done. Write that in there as well. So that covers your scope of practice. So Farooq, if you follow me, essentially, in this video, what we've discussed, and I'm just going to come here, what we've essentially discussed is we've discussed how do you get HE funding. Number one, to get HE funding, you have to make sure you meet the criteria. You're a pharmacist, you're qualified, you have the experience, you have a scope of practice, you have a DPP available. Make sure that you check with the university that they have access to funding from HE. In terms of fees itself, if you don't get funding, you're looking at anywhere between £1,200 to up to £2,500, but there are some universities that charge £3,000. Keep that in mind. But on average, about £1,500 to £1,800. That's important for you to remember. Your scope of practice should be well defined. Make it specific. Do not leave it wishy-washy. Like, I want to learn to prescribe for antibiotics. Why would you want to learn to prescribe antibiotics? Think about antimicrobial stewardship. We're trying to save antibiotics and you want to learn to prescribe antibiotics. You want to learn to prescribe when it's required. Prescribing is a tool. It is not the be-all, end-all. It's a tool that we can use. Focus on preventative medicine. So your scope of practice, well defined. And I've given some examples. And you can visit the Medlearn website. And we'll try to put some links in for you to have a look and read articles. That'll be useful for you. We've also spoken about the personal statement, anywhere between 300 to 500 words, personal statement. Link policy, talk about studying at level 7, explain how you diagnose and treat, what role you're playing, and then think about which university you want to go to. And again, thank you for watching this video. Subscribe, like, and share. Together, let's build a better world. And I'm looking forward to hearing from you, speaking to you, and together, let's make the best of our, let me restart. Let's make the best out of our profession. Thank you for listening.